Welcome to the Public Health Law Academy's training on advanced legal epidemiology methods. This training is brought to you by ChangeLab Solutions and the Centers for Disease Control and Prevention's Public Health Law Program. ChangeLab Solutions is an Oakland, California-based nonprofit that creates innovative laws and policies to ensure everyday health for all, whether that's providing access to affordable, healthy food and beverages, creating safe opportunities for physical activity, or ensuring the freedom to enjoy smoke-free air and clean water. These solutions address all aspects of a just, vital, and thriving community, like food, housing, childcare, schools, transportation, public safety, jobs, and the environment. The mission of the CDC's Public Health Law Program, or PHLP, is to advance the use of law as a public health tool. The program does this by creating tools that can be used to influence public health outcomes, for example, through legal epidemiology, or legal mapping and evaluation, legal guidance for research, including memos, literature reviews, resource navigation, and peer review, research innovation, such as methodology reviews, logic modeling, funding, and translation, and finally, through training and workforce development opportunities, including webinars, trainings, public use training materials, fellowships, internships, and externships. PHLP does all of this to serve CDC programs as well as state, tribal, local, and territorial communities. To submit a request or to learn more about public health law, you can visit the program's website at www.cdc.gov/PHLP. We also want to thank the Policy Surveillance Program of the Center for Public Health Law Research at Temple University Beasley School of Law for its contributions to the content development of this training. We want to remind you that the information provided in this training is for informational purposes only and does not constitute legal advice. ChangeLab Solutions does not enter into attorney-client relationships. ChangeLab Solutions is a nonpartisan, nonprofit organization that educates and informs the public through objective, nonpartisan analysis, study, and/or research. The primary purpose of this discussion is to address legal and/or policy options to improve public health. There is no intent to reflect a view on specific legislation. Further, while every effort has been made to verify the accuracy of these materials, legal authorities and requirements may vary from jurisdiction to jurisdiction. The contents of this presentation have not been formally disseminated by the Centers for Disease Control and Prevention and should not be construed to represent any agency determination or policy. Always seek the advice of an attorney or other qualified professional with any questions you may have regarding a legal matter. Individuals who work as public health practitioners, lawyers, and policy experts in the field of legal epidemiology need measurable skills to move their careers forward. The CDC's Public Health Law Program developed the Legal Epidemiology Competency Model in 2018 to help reflect the practice and guide practitioners in career trajectories. This module of the Public Health Law Academy will cover the 4 tasks listed on this slide to build skills for entry-level or Tier 1 professionals in the field of legal epidemiology. We want to note that these are not the objectives for this course, but general legal epidemiology competencies. The 4 tasks include identifying opportunities for a legal epidemiology study to address legal, health, or other issues, determining which legal epidemiology study designs address potential associations between law and health, collecting and analyzing qualitative and quantitative study data using generally accepted research methodologies, and interpreting results, drawing conclusions, and formulating key findings to help improve public health. This training is intended for individuals who are not in management or supervisory positions, but people who directly implement legal epidemiology research tasks such as collecting, analyzing, and coding data. This course will introduce concepts that are more advanced than those covered in other Public Health Law Academy trainings. It will focus on concepts of legal epidemiology studies, also known as legal epi-studies. It is intended for people with a background or graduate degree in public health, psychology, economics, or a related field, Researchers and practitioners with experience in quantitative or qualitative analysis, and other experts who have used statistical or evaluation methods in their work. We encourage you to hit pause throughout the course of this training. Many of the concepts we'll discuss are complicated in the abstract and may take time to absorb. Take your time working through this material and thinking through how it might apply to your work. In the first part of this training, we will provide a quick recap of legal epidemiology. Next, we will introduce the 3 phases of legal epi-studies. In Phase 1, we will discuss the steps in planning an advanced legal epi-study. We will discuss logic models, 3 basic socio-legal theories, and where to find data for legal epi-studies. We will also explore options for research designs. In Phase 2, we will explore the advantages and limitations of various research designs. And in Phase 3, we will talk about examining and understanding data. But before we discuss these new topics, let's take a moment to review what we already know about legal epidemiology. In the first training in this 3-part series, we learned that legal epidemiology is the scientific study and deployment of law as a factor in the cause, distribution, and prevention of disease and injury in a population, and that it uses transparent, scientific methods and rigorous quality control. After discussing the ins and outs of legal epidemiology in our first 2 trainings, we're now ready to focus on advanced legal epi-studies. Specifically, we will look at how scientific methods can help us measure processes and outcomes. We'll pick up where we left off with our second training and explore how to use advanced research methods to determine whether distracted driving laws affect health outcomes. Let's revisit Wendy. Remember her? We introduced her in the second training in this series called Introduction to Legal Mapping. Wendy is a public health expert who works for her state's public health department. Her task was to determine whether distracted driving laws affect health outcomes. You might recall that she chose to use policy surveillance to answer this question. In the second training, we learned how to conduct a legal mapping project alongside Wendy and her team. At the end of that process, Wendy's team had robust legal data, but that was just the first step. To fully understand the effects of distracted driving laws on health, Wendy must compare the legal data her team collected with public health outcome data. Because the goal of Wendy's study is to find statistical relationships between the legal landscape and health outcomes, she decides to give this task to the researchers in her office who have experience conducting quantitative analyses. These researchers will analyze the 2 datasets to determine whether distracted driving laws have a positive relationship, a negative relationship, or no relationship with health data on motor vehicle injuries. Ultimately, Wendy and her fellow experts are trying to answer the following question: do distracted driving laws work? In this training, we will outline the steps Wendy needs to take to figure this out and show you how to conduct a similar study with your team. Remember, you may not have the credentials to conduct this kind of analysis using the data from your legal mapping project. If that is the case, it's important to ask someone with the right experience and skills to help you. To understand the effects distracted driving laws have on health, Wendy's team needs to answer a few questions. Which cell phone-related behaviors do these distracted driving laws actually regulate? For example, do they address calling, texting, and web surfing? What are the penalties associated with these laws? Are these laws enforced? Do police stop and ticket drivers for cell phone use? Do the laws reduce motor vehicle crashes? Do the laws reduce injuries and deaths caused by motor vehicle crashes? The team's initial research questions will be used in planning, operationalizing, and analyzing data, which are the 3 phases of an advanced legal epi-study. This training will define each phase, describe the steps within each phase, and provide examples at each step. Let's begin with Phase 1. The next set of slides describes the steps involved in planning an advanced legal epi-study. To help us along, we will continue to use Wendy's work as an example. It's important to note that each phase is iterative. When conducting a legal epi-study, you'll likely make some progress and then discover you need to revisit something. For instance, you might need to go back to the evidence base to refine the question or the logic model. We will walk you through each of these steps in the planning phase, which include reviewing the evidence, drafting research questions, identifying relevant laws and legal mechanisms, developing a logic model, checking data sources, and selecting a research design. In Wendy's case, the first thing she should do in the planning phase is check the scientific literature base for published studies examining the impact of distracted driving laws. Remember, her question is very general. Do distracted driving laws work? To answer this question, she'll need to define the specific impact she wants to assess. This outcome must be observable and measurable. For example, she might measure the number of crashes, number of injuries, or number of deaths to determine whether distracted driving laws work. After Wendy's team members have reviewed the evidence base, they should have a sense of what research questions they still need to answer. At this point, the team should identify a specific research question that can be tested empirically. For instance, Wendy's research question might be, does the presence of distracted driving laws reduce crashes? The null hypothesis associated with this research question is, distracted driving laws do not reduce crashes. And the alternative hypothesis is, distracted driving laws do reduce crashes. But Wendy's team might pick something more specific. For instance, they might investigate the following research question. Do distracted driving laws with higher fines reduce the number of crashes significantly more than distracted driving laws with lower fines? As you can see, the team can take several different approaches. But what is important is that they pick a specific law or feature of law and pair it with an implementation or enforcement activity that can be measured. This will help you figure out what laws or provisions are really making a difference. Let's use Wendy's work to explain this further. In her case, Wendy must first decide what she is investigating. Does she want to measure the effect of the presence of a distracted driving law as a whole? Or is she more interested in how a particular feature in the law affects health? After she picks what she wants to measure, she must examine how the law or feature of law has been implemented or enforced. For example, to measure enforcement, she could use the rates of people texting and driving, or the number of citations written at a randomized selection of road intersections. It is tempting to try to study law as a single event or occurrence. For example, Wendy might try to study a distracted driving law's direct effect on motor vehicle crash rates in a certain state. But there are many variables at play that affect how laws play out in the real world. So what do? Because laws and their effects are complex, we use logic models to articulate theories of change and to describe visually how a law is supposed to work. Logic models can inform data needed for testing hypotheses articulated in the logic model. We're going to spend some time now exploring how a logic model can be used to study the effects of laws on health. The next set of slides will walk you through the overarching or macro-level logic model of legal epi-studies. It was created by the Center for Public Health Law Research at Temple University Beasley School of Law. Notice that there are boxes and arrows in this diagram that show how laws are intended to affect behaviors and environments, which in turn affect population health. Let's start with how laws are enacted. This is called lawmaking, and can involve everything from bill writing and editing to the introduction of the issue to legislative committees, to public notice, to policy refinement, lobbying, executive review, and finally, codification. Lawmaking then leads to laws on the books. These are existing laws. A law could be a statute, a regulation, case law, an executive order, an administrative rule, and so on. Most interventional legal epi-studies begin with laws on the books. Stakeholders want to know what effect the existing laws will have on intended outcomes. In our example, Wendy reviews the actual text of the distracted driving law in her state and neighboring states. She analyzes all the observable features of that particular law. Let's pause for a moment. Take a minute to think about this question. Which features of a law might Wendy want to study? If you said, who is being regulated or who the law applies to, that's correct. She might also be interested in studying what the penalties are. Are they fines, jail time, a revoked license? Where the distracted driving is prohibited. Do the distracted driving laws apply only in school zones, on highways, on local surface streets? She might also want to examine what the enforcement plan is. For example, whether the police must ticket drivers who are using their cell phone or ticket drivers only when they've committed another traffic violation. Now let's take a look at legal practices. Legal practices are all the activities that occur after a law is passed, such as appropriating funding, implementation, and enforcement. Referring back to our distracted driving example, knowing something about enforcement is critical in this example, and generally, it is the police that enforce distracted driving laws. If the public feels no threat of penalty for texting and driving, then we are not likely to observe an effect of the law. Let's review what we just discussed. In sum, the lawmaking, the laws on the books, and the legal practices are all the pieces of law and policy that can be examined in a legal epi-study. Here are some examples. We could design a study of how a law gets passed, which is a study of lawmaking. Design a study of the effects of a law on the books without looking at how it is implemented or enforced, though this would not be ideal. Design a study of how laws are implemented differently across jurisdictions, or we could design a study of how laws are enforced. Public health laws are aimed at changing individual behaviors and the environments in which people live, work, and play. The end goal of public health laws is to improve population health. Examples of population health outcomes include the number of car crashes and rate of injuries due to car crashes, the rate of vaccine-preventable childhood illness, the number of drug overdose or accidental poisoning deaths, and chronic disease prevalence estimates. But how can we tell whether the law makes a difference? Public health laws are written and passed to protect the public's health. In defining the public's health, we often need to think in intermediate steps. These laws are intended to directly change behaviors and environments, which in turn affect population health. Let's revisit our distracted driving example. In this case, the laws on the books are likely intended to deter people from texting or talking on the phone while driving because they fear a violation and a fine. The behavior affected is the use of a cell phone while driving. In a legal epi-study examining implementation, Wendy and her team might study the rates at which the police issue violations and fines. This could help them determine whether the law on the books is sufficient or whether enforcement is a key piece that makes the law work. In the next 3 slides, we will explain the arrows in the overarching logic model, which are represented by letters in this picture. The arrows represent the causal mechanisms between the boxes. In other words, the arrows are what actually happens on the ground between a law being passed to a health outcome. To begin, we will examine causal paths A and B. Path A. The arrow between lawmaking and laws on the books explores the factors that influence what laws are enacted and how they're enacted. Path B, the arrow between laws on the books and legal practices, explores how existing laws are transformed into what agencies are actually doing on the ground. For example, an implementation study might examine the practices of agencies putting a law into action. Now let's dive a little deeper. When creating a logic model, we might have lots of data about environments or population health. But one of the harder things to understand, and therefore measure, is the relationship between legal practices and changes in behavior, which we will now discuss. Legal epi-studies typically start with laws on the books. The studies then investigate the impact those laws have on behaviors or environments, represented here by Path C. These behaviors and environments are mediators of the ultimate measure of health itself, which is Path E. A mediator is an in-between variable along the causal pathway. It is affected by the inputs and, in turn, affects the outcomes. Sometimes legal practices, rather than laws on the books, can be the starting point for a legal epi-study. An example of a legal practice that might be the start of a study is the number of citations issued for enforcing a seatbelt law. It's worth noting that many studies limit themselves to Path B and C. Some studies follow only Path C. In these cases, the focus is on how the law or the law's implementation has led to observable changes in behaviors in the environment. These behavioral and environmental changes are used as proxies for changes in health outcomes. For example, a study of the impact of tobacco warning labels might measure the smoking rate or tobacco sales as outcomes, rather than deaths from lung cancer. Path D captures the important relationship between environment and behavior. For example, a seatbelt law might work by inducing changes in individual behavior through fear of a fine. But the widespread adoption of seatbelt use by individuals can change social norms. This kind of large-scale shift can make other people who are not worried about fines adopt the behavior. The final step, and the hypothesized long-term outcome, is population health. Population health is broadly defined here, and any number of outcomes can appear in this box. For example, a population health outcome for Wendy's study might be the number of motor vehicle crashes per capita within a state, or the number of deaths due to crashes. In the following section, we will highlight 3 of the most important socio-legal theories that help explain why and how law changes or does not change behaviors. These include deterrence theory, procedural justice theory, and the theory of planned behavior. Deterrence theory works by using legal levers, such as high fines, to deter people from doing something, such as texting while driving. Procedural justice theory is about perceived fairness of the law. If individuals perceive that the law is applied fairly and equally to everyone, then they are more likely to comply with it. The theory of planned behavior is used when social norms are involved in changing behaviors. Think about the seatbelt law we mentioned a few minutes ago, or consider a helmet law. When these laws were first introduced, very few people complied. Over time, people began to realize that seatbelts and helmets really saved lives. As a result, social norms started to change, and more people began complying with the law. Now we will expand on each of these theories, and we'll start with deterrence theory. Legal mechanisms or legal effects are the ways in which we think the law works. According to Merriam-Webster's dictionary, deterrence is the action of discouraging an action or event through instilling doubt or fear of the consequences. Deterrence works by having a law on the books with a particular sanction, such as a fine or a prison sentence. Deterrence theory suggests that before deciding whether they will comply with the law, people will assess the strength of the penalty and the likelihood that they will be caught and punished. If the penalty is high enough, and if the law is enforced so that the likelihood of getting caught is high, people will be more likely to comply with the law. Consider Wendy's scenario. For distracted driving laws to work by reducing crashes, drivers must perceive the penalty for getting caught as costly, and the likelihood that they will be caught as strong. These perceptions will make people stop texting and driving. In Philadelphia, for example, a distracted driving law is on the books. But currently, there is little enforcement and minimal threat of penalty, so the rate of texting and driving remains high. Let's move on to procedural justice theory. This theory suggests that individuals are affected by how they perceive they will be treated under a particular law and by the law in practice, which can include implementation and enforcement. Groups of individuals can perceive and experience the implementation and enforcement of a law differently. If an individual feels that the law is legitimate and that it is implemented and enforced fairly across the population, then that person is more likely to comply with the law. However, if the law itself or its implementation and enforcement is perceived as being unfair or not legitimate, then the likelihood of compliance is reduced. An example of procedural justice theory in practice is the perceived inequalities in police interactions across racial groups. For instance, Terry stops in New York City are perceived as unfairly targeting African American males. A Terry stop is the brief detention of a driver or pedestrian on reasonable suspicion of involvement in criminal activity. The stop does not lead to arrest because the police cannot show probable cause that the person detained violated the law. As a result, the driver may feel an elevated sense of injustice, and compliance with motor vehicle-related laws may be reduced. If the police were to disproportionately stop drivers of a particular race or gender under texting and driving laws, the public might consider distracted driving laws to be similarly unfair and stop complying with them. Finally, let's dive into the theory of planned behavior. This socio-legal theory suggests that attitudes about a law affect an intent to comply. Attitudes can be at the individual level or collective level. If the subjective norms regarding a law are negative, then the likelihood of the public complying with the law might be low. As subjective norms and attitudes towards the law begin to change, the likelihood of compliance changes as well. For example, some laws authorize public awareness campaigns aimed at publicizing the dangers of texting and driving. Billboards showing crashes are intended to change people's attitudes toward texting and driving so that when they get into a car, their intentions to text and drive are reduced. As the chart on the slide indicates, compliance with older laws, such as no smoking laws, is also affected by social norms. In the 1970s, the media depicted smoking as cool because the dangers were not yet fully known. As experts began to understand the hazards of smoking, the media started to document health consequences among generations of families. The resulting shift in social norms regarding smoking contributed to acceptance of and compliance with more recent no smoking and clean indoor air laws. Using these socio-legal theories and historical examples of how they work, we will now use logic models to examine some current problems that have complex linkages between the law and changing behaviors and environments. Let's proceed as if this is the first logic model you've created, and it might well be. It helps to start your thinking from the right-hand side of the model. First, identify a public health problem. In this case, let's pick the number of school days missed by all students in a school. Next, work your way back in the causal chain to identify the proximate causes and potential mediators. Though it may not be immediately obvious, this example is rooted in the social determinants of health. We know poverty and related conditions affect student attendance, but it is very difficult to jump directly from poverty to school absences. The challenge is to identify the proper causal chain. This is an iterative process and is driven by the evidence base, scientific theory, and input from stakeholders and experts. Let's look at poor housing quality, for example. Poor housing conditions can increase a child's risk for asthma and in turn affect whether she feels well enough to go to school. Laws and legal practices can influence whether homes are built and maintained in ways that prevent or exacerbate asthma. Can you identify laws that may play a role in the number of missed school days because they're related to housing quality? Some of them include the Fair Housing Act, mandatory mold remediation programs, housing court decisions, and housing code enforcement. We're now ready to move on to the next step in the planning phase. This step is checking data sources. Remember, there are different types of data. There is cross-sectional data, which captures data at a single point in time, and longitudinal data, which captures data over time. When you're first creating a hypothesis for a legal epi study, it is particularly important to identify the unit of analysis. This is what you're trying to study. For legal data, the unit of analysis can be laws or policies from federal, state, and local governments, as well as tribes, territories, courts, and even school districts. Comparing like sources, such as jurisdictions at the same level of government, provides a legal unit of analysis. For outcome data, the unit of analysis can be individuals, institutions, or systems. For example, Wendy captured state-level laws and wanted to compare their content to the number of traffic fatalities attributed to distracted driving, including the number of car crashes, traffic fatalities, or hit and runs. Well-designed studies of public health laws in real-world settings help promote effective regulatory strategies. But public health laws are often passed at the state or local level, so it is impossible to randomly assign individuals to comparison groups, as called for in experimental research design. So when a law is passed in at least one jurisdiction, how might we examine the impact of that law? A good comparison would be a state without the law. And when other jurisdictions start to pass the same kind of law, often the features of the law are not exactly the same across jurisdictions. This situation creates a natural laboratory for studying laws and the features of laws. In natural experiments, scientists do not control when and where treatments are implemented. Changes in laws, regulations, or systems that affect population health provide opportunities for natural experiments. Policy surveillance of texting and driving laws from 2005 onward can provide data for natural experiments. In August 2005, 18 states and the District of Columbia had laws restricting texting while driving, including Oregon, California, Arizona, Colorado, New Mexico, Texas, Oklahoma, Arkansas, Louisiana, Mississippi, Tennessee, Kentucky, Illinois, Georgia, Delaware, New Jersey, New York, and Maine. The rest of the states did not have any laws restricting texting and driving. Let's pause here for a moment. That was a lot of information, and it may take some time to absorb. If you haven't already, we encourage you to hit pause. Take some time to sit with the content and think about how it relates to the work you do or that you're interested in doing. When you're ready to continue, hit resume. In the first half of this training, we talked extensively about logic models and socio-legal theories. Now let's finish discussing the planning phase and then introduce the final two phases of advanced legal epidemiology studies: operationalizing research designs and analyzing data. Picking back up with the last step in the planning phase, let's take a look at research designs. A true experimental design allows for causal inference, so the key feature of an experimental design is random assignment to treatment and control groups. Why is random assignment important for causal inference? When you randomly assign subjects to treatment and control groups, you can assume that any difference between the two groups at the end of the experiment is attributable to the treatment. The assumption is that the two groups are comparable on all other observed and unobserved features at the start of the experiment. This is a very big assumption, and it is critical to understanding why random assignment is required for experimental designs. Let's say we're studying the effects of a new pharmaceutical, drug A, in reducing blood pressure. To do so, we take a random sample of males that are 25 to 55 years old. We then randomly assign half to the treatment condition and half to the control condition. When we do this, we assume that any differences between the men at the start, such as their diet, their level of exercise, and their genetic propensity for heart disease, are randomly sprinkled throughout both groups. This assumption applies to variables you measure and variables you don't. That is why you can claim you ruled out all other possible explanations. In the lab, it is possible to randomly assign mice to a particular dosage of drug. In clinical trials, it is possible to randomly assign subjects to varying treatment conditions and a control condition. But in the real world, it is rarely possible to randomly assign people to exposure of a law or policy. A quasi-experimental design, which is also called a natural experiment, is a design that allows researchers to use available, observable data and correct for the absence of random assignment through the design. In a study of the impact of seatbelt laws, for example, researchers have a number of tools they can use to properly test for causal effects. One technique is the use of an appropriate comparison group, instead of the treatment control scenario. Ideally, a study would compare people who had been treated by the law with those who had not. To make this comparison, you would identify at least one state with the law and at least one state without it. Then you would explore whether the laws or legal features are comparable and applied to similar populations. For example, a seatbelt law can be measured over time to see whether more people wear their seatbelt and whether more traffic fatalities are prevented because of it. There are many tools in the Quasi-Experimental Design toolbox, including repeated measures, time resolution, functional form of effects, comparison jurisdictions, comparison groups, comparison outcomes, replications, dose response. We'll introduce each of these research designs in the next set of slides and explain how they can help a researcher make a stronger causal claim. Let's start with repeated measures. A repeated measures design requires that you measure the same thing at multiple points in time. At a minimum, this will be 2 points in time, which is the basic pre-post treatment design. Because cause precedes effect, we measure the outcome both before and after the law is implemented. Perhaps not surprisingly, having more repeated measures is better than having fewer. This is because you might observe a time-lagged effect, or the law might have a curvilinear effect. Repeated measures over time and across jurisdictions offer the most powerful causal claims. In the example provided here, you can begin to understand that if you had captured only 2 measurements, you might have assumed an effect when, in fact, there does not seem to be a uniformly upward or downward trend. Having just one observation before and after the intervention produces weak inference, because any difference observed might reflect natural variation in the outcome over time. Collecting dozens or hundreds of observations in a time series before and after a law is implemented can boost a team's confidence that an observed difference following the law is attributable to the law. A collection of observations over time can be viewed as one time window, which is a single sample from an otherwise infinite time series. The larger the time window around a change in law, the easier it is to reliably assess the law's effects. In this example, the first 5 O's represent observations at time points 1, 2, 3, 4, and 5. Then a law is passed, so you have an interruption in the observations. Observations 6, 7, 8, 9, and 10 are collected after the law has been passed. It is also important to define a time resolution, which is whether you will measure your outcome data on a daily, weekly, monthly, or annual basis. There are several important considerations to keep in mind when selecting the optimal time resolution, including speed, variation, scale, date, and seasonality. For example, consider the speed at which a new law is expected to show effects. Laws change things slowly, and it might take a long time to see an effect. You might miss an effect if you don't wait long enough or capture enough data over time. Or you might overestimate the magnitude of the effect if the initial passing of the law created a blip, but then over time behavior reverted back to the way it was before the law was passed. So, if effects are expected soon after a law's implementation, then using monthly observations rather than annual observations will make that effect easier to discern. It's also important to consider variation in the outcome at each time resolution. For example, if there is little to no variation week by week in an outcome, then monthly or annual measures might be more appropriate. Another important consideration is the scale of the measured outcome. For example, if you're trying to measure the number of vaccines given over time, and you measure this in months, it might create a cloud-like scatter. On the other hand, if you only report yearly counts, you'll likely create a smoother curve. The date when the law took effect is also an important consideration. For example, a mid-year effective date does not work well with annual data. Let's say you can gather outcome data only at the annual level, and those data are released on September 1 each year. If you're studying a law that changed in May, it's unlikely that you will see the effect of the law in that first set of outcome data tied to that year. Finally, consider the seasonality of the measured outcome. Behavior might be different in summer than in winter. Now, let's discuss functional forms of effects. The functional forms of effects relate to the shape of the line or curve of the outcome variable over time. With distracted driving laws, for example, the relationship between the amount of the fine and the reduction in deaths might be a linear or curvilinear relationship. If you increase the fine infinitely, does the reduction in deaths follow a linear rate of reduction? Or will there be a threshold at which increasing the amount of the fine no longer causes a reduction in deaths? That would suggest a curvilinear relationship. Hypothesizing about the functional forms of legal effects brings up important questions that shape the design of the study. Do you expect the effect to show up as soon as the law takes effect? Or do you expect a delay, as enforcement or other implementation systems are developed and ramped up? Do you expect an anticipatory effect before the legal effective date due to publicity and attention to the issue at the time the law is passed? Or maybe you expect the effect to emerge gradually as various implementation systems change or norms and behaviors shift. Do you expect the effect to be temporary, dissipating over time as organizations and individuals adapt to the new law in ways to maintain previous conditions? These questions can help you and your researchers assess the type of functional form that you expect to see in the data. Each of these scenarios relates to the graphs on the next slide. Think about the type of laws that might result in an abrupt change in behavior or outcomes, a temporary change in behavior or outcomes, a delayed change, an accelerated change, a gradual effect, change in variability, or have a partially decaying effect where the change in behavior gradually decreases. Let's do the first one together. A law requiring restaurants to post calorie count signage or face fines may result in an abrupt change. Such a regulation may almost immediately and dramatically increase the posting of signs inside restaurants. This is another good place to hit pause and think through the different functional forms of effects. You can practice using examples from your own practice to work through the different functional forms. Comparison jurisdictions are those that give you a basis for comparison. They differ from another jurisdiction when it comes to the law or feature of law that you want to study. Two jurisdictions with different laws, but with similar socio-demographics and political systems, can be well matched in a study. When considering possible comparison sites, you will want to compare similar environments. For example, if you are examining the effects of a new food policy, it would be critical to select comparison sites with similar socioeconomic and food environments. Use multiple comparison sites to improve causal inference. Having multiple comparison sites offers more opportunity for stronger causal claims. Attribute differences between jurisdictions to the laws. The goal is to be able to attribute any difference between the jurisdictions to the law, and finally, to rule out alternative explanations. Now let's look at comparison groups. Comparison groups refer to the unit of analysis. If you're studying seatbelt laws, for example, you might pick two comparison groups of all the males in one state and all the males in another state. Because males tend to have higher crash rates on average than females, this might be a way to simplify your study. This approach can minimize noise or interfering data that could be caused by other factors. Selecting and including the most appropriate groups of individuals to compare is important to ensure validity. For example, let's say a jurisdiction implements a regulation to reduce injuries in auto repair shops. After the law is passed, the jurisdiction observes a reduction in injuries among auto repair workers, but does not observe a reduction in injuries among workers in other settings. This would suggest that the regulation is effective. Another way to strengthen your design is to use more than one outcome variable. This also minimizes internal validity threats. For example, if you plan to examine the effects of motorcycle helmet laws, you might want to compare the rates of car and motorcycle fatality and injury rates. Assuming a motorcycle helmet law does not affect car fatalities and injuries, this comparison would rule out some other explanation for a reduction in motorcycle fatality and injury rates. You would try to select an outcome that is related to, but not directly affected by the law. Another way to strengthen causal inference regarding a law's effects is to replicate the study across jurisdictions. Replications allow you to test the same effect more than once. If similar effects are observed in each place where a similar law is implemented, we can infer that there is a strong causal relationship between the law and the overall effect. Replication of studies can happen not only across multiple sites, but also over time. If a law changes multiple times within one state or municipality, then you have multiple opportunities to test the effects of the changes. In this slide, the top design suggests that 3 observation time points occurred in a single jurisdiction before a law was enacted. 3 additional time points were captured after the law was passed, and then the law was rescinded. Then 3 subsequent time points of outcome data were captured. In other words, you have 2 sets of data for which there was no law in place. The bottom design suggests that 2 observations of data were captured before a law was enacted. Then, 2 additional time points of data were collected before the law changed in some way. After that, 2 additional time points were collected, and so on. This would give researchers multiple time points under 2 sets of legal landscapes. For example, we know the causal effects of compulsory motorcycle helmet laws. Deaths decline abruptly when helmets become compulsory and abruptly return to the higher levels when the law is rescinded. Dose response is a clinical term, but it is applicable to laws when referring to a group's level or amount of exposure to a law. Dose response is of interest when states have preempted localities from passing laws on topics like gun control, tobacco, and paid sick leave. Dose response is also of particular interest when states do not have a law but local jurisdictions do. When a state passes a law and a city goes beyond the state law to legislate further, then the dose would differ for people who live in the state but don't live in the city with the stricter regulations. Clean indoor air in Pennsylvania is a perfect example. The state does not have a clean indoor air law, but Philadelphia and Pittsburgh do. So the minute you leave either city, you may go into a bar or a restaurant that allows smoking. Be careful not to misappropriate a dose response. For example, if you looked at Pennsylvania state law and used average smoking-related illnesses as outcomes of the state as a whole, you would be misappropriating dose because you would not have accounted for Philly and Pittsburgh. Let's walk through an example together. As you might recall, in 1984, Congress passed a law requiring states to raise the minimum drinking age to 21 in order to receive federal highway funding. Some states were slow to raise their drinking age, while others moved quickly. If you wanted to examine the effects of raising the drinking age and use multiple design elements to strengthen your causal claims, you can do the following. Select the states that had not yet raised the drinking age during the period of analysis. In this example, let's say the treatment states are Maine and Michigan, which initially kept the legal drinking age at 18 and older. The comparison states are New York and Pennsylvania, which raised the legal drinking age to 21 and older. Within each state, you should stratify the drinkers by age group because you know the law might affect these 3 groups differently. Lumping them into one average might mask the effects. So you would have 3 groups: people who drink that are younger than 18, people who drink that are ages 18 to 20, and people who drink that are 21 and over. This last group would be the comparison group. The drinking rates of the comparison group should not be affected by the law. Within each state and within each age group, you will compare two sets of outcomes. You'll compare the rates of alcohol-related single vehicle crashes that happen at night and where the police report drinking was a cause, to the rates of non-alcohol-related daytime crashes where the police do not report alcohol as a cause. This comparison allows you to tease out the effect of the law in a scenario where the number of overall crashes is going up for other reasons. It also allows you to examine the outcomes when you control for time of day. In some cases, endogeneity becomes an issue. In plain English, endogeneity means you may have gotten the causal path wrong, or there were alternative explanations to what you observe. As a result, the logic model and subsequent statistical model does not properly capture the way causation works in the real world. Let's use an example to illustrate what this might look like in practice. Consider this question: what led to an increase in seatbelt use? When we claim seatbelt laws cause people to wear seatbelts, we assume that there is no alternative reason for the increase in seatbelt wearing. But suppose, for example, that right when seatbelt laws were taking effect, car makers began programming cars to make an annoying ringing sound until everyone in the car fastened their seatbelts. In this model, we would have an endogeneity problem because we now have two potential and perhaps related causes for the observed increase in seatbelt use. This problem is called omitted variables endogeneity. You can address this problem by adding the missing variable to the model if you can measure it, and then trying to assess the extent to which the two factors influence seatbelt use individually and through their interaction. Before moving to the next section, let's pause for a quick multiple-choice question. Which of the following design elements strengthens a design? A. Using many repeated measures. B. Using the highest time resolution possible. C. Comparing multiple jurisdictions. Or D. All of the above. If you selected D, that's correct. All three design elements strengthen a quasi-experimental design. Once you have made it through the planning phase, you begin to operationalize the plan. We will now look at phase 2, the operationalizing phase. At this stage, you move from talking about concepts and features to identifying variables that you will use to measure the components in your logic model. Like phase 1, phase 2 is iterative and follows this general process for operationalizing the plan. We will walk you through each of these steps in the operationalizing phase, which includes building legal and outcome data, identifying an analytic plan, selecting variables, and merging data for analysis. Phase 2 does not end until the data are clear and ready to be analyzed. Wendy can begin operationalizing by conducting a full inventory of all the data sources that were identified in the planning phase. The type of legal epi-study design will inform whether she needs legal or outcome data or both. Because she is studying the effects of a particular law on an outcome, she will need both legal data and outcome data. After she's finished organizing her final data sources, she will build or find an existing longitudinal, multi-jurisdictional distracted driving law dataset. She could find those data at lawatlas.org. The team would then need to figure out how to obtain state-level crash data. For this, the team could go to the National Highway Traffic Safety Administration's website. The epidemiologist or statistician would download the two data sets and prepare them for analysis. This would include reviewing code books, selecting variables, and paneling the data. Paneling the data means to take data and prepare it for longitudinal, time series analyses. What is important to note here is the time it will take to acquire data, clean data, and merge time series data. This process takes a sophisticated data analyst 1 to 3 months. Getting to know every variable, its properties, and the range of values is time-consuming, but a necessary step before moving on. If you are planning a quantitative study, the operationalizing phase requires a team that includes a statistician, epidemiologist, or other quantitative methodologist. The study design and data sources drive the analytical plan. Conducting an advanced legal epi study means you are testing causal links in the logic model, but there are steps that happen before you can test causality. If you only have observational data, you will be running descriptive and predictive analytics. Descriptive statistics are means, medians, modes, variances, and ranges. Regression techniques can be used in predictive and causal analyses, which can use the same statistical tests to address relationships. Predictive analyses are meant for predicting whether one attribute is associated with another attribute, but they do not allow for testing causal links between one attribute and another. Causal analyses control for all potential confounding factors, so the research team can make a plausible statement like, attribute A causes attribute B. For example, with the correct research design and analytical plan, Wendy's team can say, evidence suggests that higher fines cause lower crash rates. If your design allows for causal claims, then you can run more sophisticated types of multivariate regression. The difference in difference model is the most common analysis for advanced legal epi studies. The name comes from the fact that you are estimating two types of differences simultaneously. To see what this would look like in practice, let's say Wendy's team is conducting a simple two-state study between state X and state Y to determine whether distracted driving laws affect traffic deaths. The number of traffic deaths is the outcome they are studying. State X has a distracted driving law, and state Y does not. Her team measures the number of traffic deaths at two time points, one before the law was in place and one after the law was in place. All other things being equal between the two states, her team should observe a change in traffic deaths in state X, which has the distracted driving law, and they should observe no change in outcomes in the state that does not have a law in the books, hence the name difference in difference. It's common for a data project to begin with 30 to 60 variables and be whittled down to 5 to 10 variables of interest. Simplicity is best in regression models. Try to shoot for the smallest number of variables needed to efficiently explain the variation in the outcome, unless the sample size is large enough to support a larger number of variables. Preparing the data file for analysis is also a task for a quantitative methodologist. Identify early on which software package you will use to analyze the data. Each software package requires a different data structure. Now we're ready to talk about Phase 3, which focuses on analyzing data. Once you've hit the analysis phase, any quantitative analyst can run through the standard univariate, bivariate, and multivariate techniques. These include descriptive statistics for each variable, crosstabs and t-tests for exploring bivariate relationships, and regression and causal analyses for predictive and causal inference. Studying the impact of law is no different from studying the impact of any other intervention. Basic courses on quantitative analysis or statistics would provide the guidance for the first two steps, descriptive and bivariate analyses. Remember, plots, plots, plots. Examine the visual display of the bivariate relationships and the difference over time. Team up with an epidemiologist or quantitative methodologist to carry out the causal analyses and interpretations. Every analysis begins with basic univariate descriptive statistics for the outcome variable and each input and mediator variable. The univariate descriptive statistics help identify missing data, outliers, and responses outside the range of plausible values. Data cleaning is an important first step. It's important to note that univariate descriptive statistics are also referred to as summary statistics. Descriptive statistics include at least one measure of central tendency, such as a mean, median, or mode, and at least one measure of spread, such as range, standard deviation, or variance. The purpose of predictive and causal analyses is to find the right set of inputs and mediators that explain and predict the variance in an outcome. This is why it is important to observe data over multiple places and time points. If there is little variance or spread in the outcome, there won't be anything to explain. The second step of the analysis includes plots and bivariate tables between each input and mediator and the outcome. Plots will illuminate functional forms and relationships between inputs, mediators, and outcomes. In this graph, the percentage of traffic deaths in Colorado that were related to marijuana use is shown as a univariate plot of the outcome of interest. Note that there seems to be a steep uptick in marijuana-related traffic deaths after the recreational marijuana law was put in place, but not in the same year the law was passed. Perhaps drivers were more careful immediately after the law went into effect, and then the fear of penalty wore off. But can the upward tick be attributed to the legalization only? Logic models and hypotheses tests with strong quasi-experimental designs and causal analytics would help answer this question. You must follow descriptive plots of tests for association, such as chi-square tests for nominal or ordinal data and t-tests and f-tests for continuous outcomes. The third step is to examine the correlation matrix to see if you have redundant information in the data. Can you omit variables that are eliciting the same or similar information? You can look at which variables individually appear to be correlated with the outcome. We talked about analytical plans in Phase 2. Recall that many types of regression analyses appear in advanced legal epi studies. These include, but are not limited to, random coefficient models such as difference in difference, interrupted time series, regression discontinuity, hierarchical linear modeling, and multivariate analysis of covariance. We won't get into the nitty-gritty of how to conduct these analyses, but the important point to note here is that, like Wendy, you can have an epidemiologist or statistician help design and carry out the analysis. Now you're ready to put all the pieces together. Reading through the results of your analyses is the fun part. This is where you test the hypotheses you laid out in the beginning and start to understand whether there are statistically significant relationships in the model. The first set of results often leads to a set of iterative runs of the models. Sometimes you delete variables that are not significant to make the model simpler. Once you have finished running the models and you are satisfied that you have answered the research questions you started with, you can move on to discussing the results. There is always a discussion about whether a statistically significant relationship is of practical significance, and this discussion commonly starts with a conversation about the size of the effect. A relationship might have a p-value less than 0.05, but the size of the effect might be so small that it makes the findings practically insignificant. It's important to identify any strengths or weaknesses in the study design and the data. Readers of your study want to know if you used proxy variables because you couldn't get a direct measurement of a feature or construct in the model. Be sure to discuss possible threats to validity and reliability of the study findings. It's also important to highlight key results and identify next steps for future research. Was there a significant causal link between the presence of a law and an improvement in a health outcome? What do we still need to learn about the relationship between the law and the outcomes? Or do we know all there is to know? Once you have your findings written up, you must decide how to share them. How should you disseminate the information to the relevant stakeholders? Should you use peer-reviewed journals, policy briefs, research briefs, presentations, or infographics? To help answer these questions, consult with your communications and policy staff to identify key stakeholders, such as researchers, policymakers, policy analysts, public health practitioners, and other groups and organizations. They can help you determine how best to communicate with each of these audiences and help you identify the types of materials that would be most useful to them. Here's a recap of what we discussed. We first provided a quick recap of legal epidemiology. Next, we introduced the 3 phases of legal epi-studies. In Phase 1, we described the steps in planning an advanced legal epi-study. In Phase 2, we explored the advantages and limitations of various research designs, and in Phase 3, we focused on analyzing data. The views expressed in this training, including written training materials or publications, do not necessarily reflect the official policies of the Centers for Disease Control and Prevention or the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. Like all trainings associated with the Public Health Law Academy, this training provides legal information but not legal advice, and no attorney-client relationship is created. Please contact an attorney in your state if you need legal advice. Thank you for attending our training.